So let's start our today's lecture. Okay, so the system differentiation, we normally we have different methods. So, but to me, everything starting from the A principle. So the A principle means the yang, yin yang. So we have like 4 terms, like in the pairs, like yin and yang as one pair, one couple, and exterior, interior, cold and heat, and deficiency and excess. These are kind of 4 couples, and they are the core of our the starting of our differentiation and diagnosing conditions in TCM practice. However, everything started from yin yang, then you go down into deviate into the exterior and interior. So when you have a exterior and interior, then it comes down to, I just need to mute everyone. When you come to those exterior interior differentiation, then you go into these 2 ways. So you need to really decide whether this condition is exterior or interior to be able to go down to different way, different direction for treatment. So in the end, the very important thing is to help to differentiate what whether this condition is more of exterior or more of interior. And therefore, when you come to the exterior direction, then you need to use the other method, which I think the basic A principle is not enough. A principle, when they call it the exterior condition, they normally use those 6 evils, the EPS, just the 6 yin, they use the 6 yin, the 6 exterior evils method to help to differentiate. But I found they are not enough, just because if we can bring in the 6 channel, the Liu Jing or Wei Qi Yin Xue, when it's heat oriented or cold oriented, you can have different types of directions. Then they will help you to get more details and more precise diagnosis. So this is how the 6 channels and 4 stages comes in with those exterior oriented conditions. Then if you decided this is the interior condition, then normally you'll go into the internal organs differentiation, which can be also fused with the 3 yin in 6 channels. So in the 6 Jing Bianzheng, in the 6 Jing 6 channels, the 3 yin channels differentiations can also put into those internal organ differentiation. So that's a good sort of integration with 2 directions. But more important with my own method, apart from the original and initial like pulse reading, interrogations, and tongue readings, I also combine my meridian differentiation into that. So meridian palpation comes in from all these steps of those differentiation methods throughout the 8 principles, because the meridian palpation can help.
Recording in progress.
So the meridian differentiation is able to help to bring in the precise the differentiations, and we can by reading the meridians, you are able to really tell whether this is the heat or the cold, whether this is deficiency or excess, precisely with those methods we teach in the meridian palpations. So, and then all these meridian palpation workshops will be able, or CPD courses will be able to really give you more teaching, learning, and practicing methods, the opportunities. So you're welcome in the future to attend one of my lectures, courses, if you like, either in Chinese or in English. But before we look into that, as I say, A principle as the foundation. So you need to really go into the A principle first. Then the first step of A principle is the yin yang. The reason for me to put yin yang as the first, and also the important starting point. It is very important when you really go into later on, especially with like meridian palpation. They're very important. It's just because they can give you a general impressions about things, and then later on, for the yin yang, starting to qi and blood, and starting into yin and yang differentiations, which is very important and very helpful in the future. So first thing is to inspection. So you will see from looking. So yin sign and yang sign, I think everyone is familiar with this. We don't need to really do too much of that, okay? And listening, smelling, and also this is all common signs and symptoms that you should be learning in your fundamental trainings. But I want to emphasize something else, which quite often, many of my students can tend to ignore or are not being fully aware of those yin and yang signs. They are the one that we're going to talk here. So you can see the diagnosed yin and yang in the body, because they can actually give you a lot more information rather than those signs and symptoms that we mentioned earlier. These are the ones that actually help me to straight away identify the yin yang, and also identify, because from the yin yang you get it developed into qi and blood, or yin and yang, that kind of body materials or substances, and then they are going to give you a lot more, the close to practice, close to clinical aspects information. They are much more practical information. So here we'll talk about the right side of the body. They belong to the yang. So therefore, and the left side of the body, it belongs to yin. That means anything happening on the right side of the body, they tend to indicate more problems with the yang nature of your systems. That means there could be either qi or yang deficiency, or qi or yang excess. Anything happening on your right side, on your left side of the body, that belongs to the yin nature, which means then you find out this is more to do with blood or yin deficiency, or blood and yin excess. So, for example, people coming from you with the back pain, if they're having on the left side back pain, with the left leg pain more pronounced, usually that indicate this is to do with some colds, wind, damp, and cold attacking, right? Or if they have repetitive problems for a long time, that usually means also the person may have quite deep, deficiency of blood or yin. So then you need to look into if that is the relevant, signs for the relevant differentiation. Therefore, you can treat accordingly. So for those type of people, you're not only just trying to just do the local points to remove the pain. You need to look into the things that might help more. Like, for example, if you think this is constantly on the left side, maybe to do with damp cold, then you can use moxa. And if it's to do with a blood and yin deficiency, you might need to also consider to use the choose point to tonify the yin and blood. So that is the one that guide you through to a more successful and practical ideas of treatment. And upper body is yang, lower body is yin. So that also have significant, clinical significance. That means if you tend to have more problems with the upper body, like for example, the eczema or skin rash, if they're happening more on the upper part of the body, they indicate more yang issues, so more heat or more wind heat, right? If it's in the lower body, there could be more damp and cold or yin deficiency. So that is the thing that can also give you some ideas where, we're looking into those relevant informations. And very important also for the pulse. So when you touch the pulse, the first thing is to compare before the left and right. So if the right side feels much more stronger than the left side, then that means, okay, this is a more it tends to be a more yin and blood deficient type, and relevantly the qi is stronger. So that is the thing. Or, for example, both floating poles, the poles happening showing more stronger superficially on the left, quite often indicate this is a cold type of external attack invasions. And if it's more on the right side, that could be indicated that as a certain type of heat nature. Then you need to consider, even though that is a wind cold attacking, which is quite often, that is always internal heat that pushing the right poles more superficially. So that is the thing, and that can give you the idea of yin yang, and also further down more details and differential informations to dig to enable you to dig down deeper. And also daytime, nighttime, everyone knows is typical. People like, for example, the skin issues and cough. People have more severe at nighttime. They usually indicate this is the top problem with the cold or the yin deficiency or blood stasis. Cough, pain, itch, the same thing. If they have a problem with more a daytime, normally that's excess, that's heat type of that issues, right? So I remember when I have one lady who came for an overall skin rash, whole day, very, very itchy, but then more worse at nighttime. So in the end, we believe that throughout the day, that means there could be the excess heat, but worse at nighttime, yin deficiency. So this is basically the lady come at a menopausal age, and then she's been having that for a long time, for about a month, and all the steroids medication didn't really help her. And then she was actually a secretary of the dermatology specialist in hospital in the UK. So even the hospital especially could not really do much about it. So what we did with her was bloodletting on the ear tip, so to get rid of the heat in the blood, and also a strong kidney yin tonic and blood cooling medication to her. So within, say, after one treatment, she had 3 days, no itch at all, which you should say that's a miracle. And then after 2 weeks of medication, she gradually calmed down. All the itches are starting to ease off. So, and then, so that is the ideas of that, the starting point is to get all those proper information and differentiate and diagnose properly. So that is what we say yin and yang as the basis, but also very important the starting point of your differentiation. And this one, just to give you some idea, you can see this lady's tongue, and left and right, they have completely different shape, you can see, right? So you can see one side narrower, one side fuller, although you can see the tooth marks and everything. But obviously, when you look at this tongue, you already know this lady has a puffy tongue, damp cold, and spleen qi deficient, tooth marks, or scallops on the side. However, left sides were sort of narrower than the right side. That actually indicates a certain level of yin and blood deficiency. So for her, you can also see the red spots on that. So that's yin deficiency and blood deficiency. So and then the diagnosis is not only just from the look of the tongue. The diagnosis should not only be limited or restricted to spleen qi deficiency and damp cold accumulation. There should be also including the blood deficiency and yin deficiency altogether in here. Right, and then actually this is also a reconfirm when you actually look at her meridian palpation. You can see instead of very high sensitivity on the spleen 9 and all these spleen and damp related, she also had highly sensitive kidney, heart, liver, yin points sensitivities, and also apart from that, she also had highly sensitive yang meridians. That means she's not only having the internal organs issues, she also have the external issues. And how to tell the external issues from the tongue then, we'll talk about later. But just give you some hint of that. Look, external tongue usually reflects by the look of the coating and also the color of the coatings, the color of the tongue body too. Okay, so that's all about yin and yang, but now we move on to the exterior and interior. there are two types of exterior conditions that need to be aware of. First thing is disorders affecting skin and muscles. So that's the 皮部 cutaneous sections, and 经经 is the muscular tendinous sections or channels, whatever you call it. So, and this is actually affecting the Wei Qi, the defensive Qi, levels of that. So, and then we'll talk about what Wei Qi Bing, Yin Qi Bing, the nutritive Qi illnesses or Wei Qi illnesses. This is all the concept in the meridian palpation training course. This is caused by exogenous pathogens of acute onset. So the symptoms includes like, the sudden onset usually of the invasion of winds. So either the wind heat or wind cold. And that's, that could be related to this aversion to cold, fever, sneezing, running nose, and itchy throat and everything, because they're affecting the skin. So it's not only the skin rash like eczema or psoriasis, but also it's affecting the usual like a cold and flu kind of symptoms that could be all included here. But when it's the cutaneous skin 皮部 conditions subsided, or they go more developing further, then they will go into the channels. Then the illnesses develop more deeper. So then it comes to those disorders affecting the channels. So they can be acute or chronic. So then you see actually two deviations from here. The first one, what I call a channel exterior organ interior syndrome. So that means the channels or the meridians along with the relevant organs, internal organs, illnesses. So, and these usually involve more a neutral qi. So that, the yin qi, so what we call the yin qi bing, yin qi illness. So then those hot and cold, excess deficiency nature of body constitution play a very important part now. Okay. So those evils or the exterior pathogenic factors, invasion into the channel, ending chronic and lasting symptoms. So in the end, may settle in relevant internal organs. So we are actually talking the development, different depths of development. So these actually, if we include the first, affecting skin, cutaneous, muscular tendinous, those parts, and those channel exterior and organ interior syndrome. This is actually, if you look at this COVID-19 development, it's very much a lot in here. So you can see in the symptoms, in the beginning of the symptom of COVID infection, people can have like chills, fever, headaches, and then they gradually develop into symptoms, either digestion symptoms, diarrhea, vomit, sickness, or incontinence, or bladder issues, or other issues. Then they gradually more further develop into the lung, affecting the heart, liver, or kidney, and many other internal organs. This is exactly the development of that, the procedures of this development of the illnesses. But apart from that, we actually have another one, relatively less internal, but then the channel exterior and organ interior syndrome. But they are slightly deeper than the skin and muscular tendinous. This is the lower connecting channels and joint syndromes. They only just stop at the that level. So they developed in the lower vessels, and then also they stops at the joints. This is how people start to develop the inflammations on joints. So like arthritis. So normally we call this lower blood illnesses. So you can see when the illnesses coming into the body, they actually develop into different directions. It depends on the strength of those pathogenic factors, how they like say how bad and how critical or how poisonous these these pathogenic factor can be, like say COVID. And also it's determined by the constitution. So if a body who's received all these illness, the infections, if their constitution is strong, they might just stop its developing at the first level. So the first level of those skin and muscular tenderness areas. So only just that they have very mild symptoms. But if their constitution is weak and they're not able to really sort of stop this progressing, they might go deep down, travel along the channels, develop into and enter into organs and settle into organ. Then they can become a very, very, very severe conditions like critical conditions. Or they could be just stopped at those lower connecting or joints and develop into the arthritis. Right. So you can see some of the patients may in the future COVID symptoms, what they call long COVID. They could be having troubles with superficially on the skin levels, or some internal organ development, or some arthritis symptoms. People can even have like symptoms very similar, like fibromyalgia, muscles, or joint pains. Right. So that you know, when you look at all the illnesses, a intense collections of all the symptoms, you can see a very clear picture how actually the exterior conditions are developing to the interior, how those kind of interactions and how the body, you know, develop into different directions. And then we try to, and all these are actually written in Yellow Emperor's book. We just make our own reorganizing of the wording in here, trying to, you know, get long chapters into several smaller lines of writing. But I think the idea is clear. You know, the problems coming into the system, they can come into at these three directions, and then they will they might show in different stages of the disease, or stops in a certain level of that sort of the process. But once you understand this, then you can treat accordingly. So diagnosis of the exterior, we're down to now. We say the characteristic of exterior conditions are acute, usually seen in first stage of the illness, on surface of body like skin disease, chills, usually due to exposure to one of the 6 evils, often affecting head and shoulders because they are upper part of the body. And first sign, sudden onset, acute disease, fever, chills, cold and flu with aversion to heat or cold. But not only that, you know, that includes many other symptoms. And also, when I put it here, but not only that, just because we need to also look into the 3 yang channels, because every yang channel, they have their specific, or what you call exclusive characteristic symptoms belong to them. Therefore, the descriptions of those symptoms can be a very, very big writing. However, so we are going to just give a little bit of covering on that today. So that includes the conditions like cold, flu, fever, headache, respiratory congestions, eruptive skin diseases, and so on. Many. However, very important, as this is also a kind of blind spot for many of students. When we talk about like exterior conditions, people may only understand this is the condition that's related to the yang, what they call exterior, the cold and flu symptoms, right? But actually, in my ideas, right, especially when we talk about like 3 yang and 3 yin, anything involving the 3 yang channels is included in those exterior in my system, and that is much easier than just understand when you talk about exterior, it's only the cold symptom. It's not. It's include Taiyang, Shaoyang, Yangming, which means also Taiyang includes the hand Taiyang, Xiaochang, the small intestine, foot Taiyang, bladder, Yangming, hand Yangming, large intestine, foot Yangming, stomach, Shaoyang, hand Shaoyang, Sanjiao, and foot Shaoyang, gallbladder. So all these 6 yang meridians, if they are involving with these conditions, they are all still called the exterior condition, just because they are yang issues. Therefore, when we talk about this differentiation method, we'll be following the 6 stages or the 6 channels, right? So especially when this condition is cold-oriented, wind-cold-oriented, they're very much 6 channels. And if they are related to this wind-heat-oriented, you quite often you can use the 4 levels. However, the 6 channels and 4 levels or 4 stages, whatever you call, they are not conflicting with each other. They're not clashing with each other. The 6 channels can include the 4 stages in many ways. So 6 channels is still the core of the whole exterior conditions diagnosis in my system. Just give you some ideas about the tongue for exterior, as I mentioned earlier on. The tongue usually is not very obvious, but however, there are some signs that can give you some hint. Then you can go to for me, to diagnose those young channels issues or exterior issues, the very best method is to go down to the 6 channels, the meridian palpations. But the tongue reading can still give you some good hint and clue. For example, for the Taiyang, okay, so I normally say it's the uneven coating of tongue. So you can see the gentleman's tongue, and the coating looks greasy, but on top of, beside the look of greasy is actually uneven surface. Okay, so some part of the coating thicker, some part is thinner. This is actually a look of a beginning of exterior condition. Now, this is the normal type of the coating you can see. But when you look at this lady, well, earlier on this lady, you can see also this is a type of uneven coating. So it's not only just the coating side, it's just because this layer of coating, some parts on the same levels, you can still see some parts thinner, some parts thicker. That is actually a sign of Taiyang issues. And Shaoyang, you will look different things. Shaoyang, first of all, the tongue. Usually with the Shaoyang issue, tongue looks puffy because Shaoyang usually involved in the spleen deficiency. And pale or light red is purple color. So you can see the color already purple, kind of light purple, blue or light green kind of purple, right? And then also the coating is uneven, or the tongue size uneven. So you can see one side, this part of coating is longer than this side. This is the kind of uneven. This is also Shaoyang type of that, the tongue size for that. For Yangming or wind heat, because usually when wind heat syndrome, which is the 胃气营血 differentiation, the 4 stages, they usually is heat oriented. And when Yangming start to show up, Yangming usually is a heat leading symptom. Although they quite often you have some Yangming cold symptoms, but when body developing into Yangming condition, quite often that's the Yangming heat. So we will expect to see the Yangming on the color of tongue, usually redder tip, and also dry coating. So not only this kind of uneven look, it's the dry, lack of body fluid type of that coating. That is very typical, especially with this type. This picture from my computer looks very much as I said, but when it shows them here on my mobile, that looking very much Yangming. But when you look at it in the computer here, it doesn't look very typical. However, the red spots indicate the Yangming heat. And for this lady, very much dry. Okay. Also, you can see kind of uneven coating. That is also Taiyang type, right? And the purple color, that is the Shaoyang. So this actually is Taiyang, Shaoyang, and Yangming all together. So we suppose with the tongue, you already have some general information and general ideas, which will be covered a lot more in my following 3 weeks of every Sundays, the differentiation, 8 principle differentiation CPD. And today just a very quick and brief introduction. And then for the pose, these also they are signs for exteriors. The exterior for signs is going to be felt and demonstrated by the superficial depths of what they call floating pose. When there is a floating pulse, that usually there is a indicators for exterior conditions, right? So you see there are some type. They are not the partitions for organ allocations, that type of reading for the superficial level of pulse reading. We only pulse reading on the superficial level, on the shape of the pulse, the feels of pulse. When you feel superficially, and we feel that floating pulse on the patient, you just need to really tell what type or feel of those pulse is, right? So they are like tight, or wiry and thin, or slippery. So usually it feels very tight. Usually that is Taiyang. So involving the bladder and small intestine meridians. If it feels very wiry and thin superficially, that usually means this is a Shaoyang, though that's involved the gallbladder and Sanjiao meridian. If it feels slippery or soft, quite often that involves more or less some Yang Ming issues, and then that's involving the stomach and large intestine meridian. And also remember, when you feel more on the left, that's indicating a cold nature. When you feel more on the right, they're indicating some heat nature of that. So pretty easy with those. And then once you get into these patterns of thinking to diagnose the exterior and interior, it's very easy. And then we just need to do it step by step. More important, apart from the tongue or apart from the pulse, we also have a very, what we call the golden fingers of techniques is the meridian palpation, which means with this meridian palpation, it will give you a lot more strong confidence on diagnosing all the conditions. Say, here we go, those three yangs, Taiyang, Shaoyang, and Yang Ming, they all have their own meridians. And then you just look for those sensitive points on the ratings, which will straight away to tell you whether there is problem with the relevant meridians, and then the three yang channels will be clearly differentiated by those readings of that. Yeah. So also the left and right sensitivities, the rating difference can help you very much clarify the cold and heat differentiation. So you just need to really do the left and right side for the ratings and collect all those reading result, and then you do your final analyze once you get all those reading done. So then we'll still talk about the exterior. So again, starting from the yin yang, left and right, then you go down to the tongue reading, your pulse reading, apart from those symptoms you already collected, and then you go down to meridian palpation. That's good enough really to help to make the differentiation stand out. But then once you say, okay, exterior has been cleared out, we already done the job, we need to really identify if there is an internal condition. So internal will be following a different rules here. So once a disease is an interior, regardless of etiology, it is classified as an interior condition. So you can, many times you can have conditions, exterior combined with interior. So once you have some problems, developing into the internal organ, then it will be still called interior, but they might still also have some exterior issues, which sometimes need urgent attention, which means for some symptoms, major symptom of patients is really to directly with the exterior, then you need to treat them accordingly. But if the patient coming with another prominent symptoms that's more closer to the interior, then you might need to just pay attention to the interior. However, when you look at whole body, you still need to look at exterior levels of issues, interior levels of issues. And following that, there's also other what we call secondary pathology level of issues, means those toxins accumulating in the system, which we'll be covering later on of this lecture. So you can see here, interior condition may have a slow onset, a chronic, patients will feel hot or cold, organs will be affected. So then it can be many things, causing this problem. And then pulse will be felt more in the deeper side of the body, so some median level, median depth. So differentiation method will follow the internal organ differentiations. First with like 3 yin channels of 6 channel, or yin and blood levels in 4 levels. It is to do with the heat. And these are the two pictures for those tai yin, which means the foot tai yin, spleen, hand tai yin, lung. The left one is spleen tongue, right, puffy tongue. And the lung tongue is this one. So we call it about the lung tongue. You could dip and tender and lungs on. You can see this here. The lung area is very dippy, right? And especially on the left side, she has the yin deficiency, lung yin deficiency. So you understand the interior conditions is also diagnosed by the basic allocations of tongue organ distributions. So you know that the front part of the heart, and then the side, lung, middle, spleen, side, liver, roots, kidney. That is what we do, right? Okay, so here we go. This is also the heart and the kidney. So you can see here, dippy heart, right? And this, to mention, this is also, you can see some kind of purple color. This is also a kind of, that is a certain uneven coatings, along with the purple color. This is Tai Yang and Shao Yang combination. But these gentlemen also had some dippy in those lung and heart areas, and also split as heart, right? And for this lady, you can also see a dippy and kind of narrow root in the kidney area. So she's also having some kidney deficiency type of issues too. Jue-yin is also very important. I think many people are having troubles to identify the Jue-yin that precisely. When we look at this tongue, the Jue-yin tongue, apart from those, the Shao-yin, you can see Shao-yin also kind of tender and red color and kind of, you know, peelings and little coatings. But Jue-yin, not only just red, not only just tender look, it's purple, deep red purple. It's a Jue-yin tongue. So this boy, I shared this case with meridian palpation classes as well. For this boy had fever, and then at nighttime cannot sleep, and also coughing at nighttime, and then particularly fever at night, and because a very small child, and he doesn't like to go to see doctors, and he cries and struggles all the time. So parent didn't want to, so therefore distantly asking for help. Then we realized this is the Jue-yin, and then so that was one of my students' case, and he didn't know what to do, and in his early journey of learning from with meridian palpation. In the end, we realized, well, I identified this tongue coating and also identified this tongue's color. I say, okay, this looks like a Jue-yin tongue. So you might need to look into the liver, the pericardium, but also don't forget, maybe Jue-yin also involving certain level of Shao-yin. So you go to the heart and kidneys. And in the end, the pericardium was the most painful point we found on this boy. And then there is a certain level of sensitivity on the liver and kidney. So we just do the point on that, ask the parent to do that on the hand of the child. Just over one night, the temperature dropped greatly. So just after 2 days of that treatment, without any medication, the boy is back to normal. His tongue was better, and fever's gone, and start to eat, and everything's back to normal. And this is also another case of skin issues with insomnia, severe insomnia, 4 nights not sleeping. And then the formula she showed to me was mainly just like kidney tonic and the cooling, but didn't work. But for me, this is Jue-yin. So apart from just giving her these the cooling blood, the herbs and kidney tonic, yin tonic, or damp heat, and all that, we adding the Jue-yin cleaning herbs, and that greatly help her with the itch as well as the sleeping issues. Right. Okay. Also, we should understand the constitution also include the number 3 aspect of body, so the secondary pathology, which means the body has the efficiency of body could develop into the accumulation of toxins. Those most common ones are like the phlegm, or the dampness, and blood stasis. These are those ones that you can see from the photos. Obviously, these you are very much familiar with, so I don't need to spend my time doing too much of the explanation to it. But you can see most of these like thick coatings, right? And then they are more or less showing a certain level of troubles. The pulse also, these further information should be able to get from the future lectures. But then to give you the general brief ideas, it follows the organs partition on the pulse reading is felt in the middle level of your pulse reading, and it feels apart from those organs allocations, but it also feels the shape and the strength of the pulse, and then give you different differentiations and analyze. And then deep depths, when you push the pulse deep down to the bones, this is what called deep depth. And the pulse will, if there is a pulse showing up here, they normally indicate it's a deep down stagnations of secondary pathologies. For example, the cold, the phlegm, the blood stasis, or chi stagnations. Therefore, when we come to after these symptom collection, after the tongue reading, after the pulse reading, then you go to those meridian palpation to give you a full feel, the complete process or diagnosis. And then you go to the Sanyang, there's the Sanyin, the 3 yin channels, like the Taiyin, spleen and lung, Shaoyin, heart and kidney, Jieyin, liver and pericardium. And left and right help you to identify the yin and yang, that part of that, and hot and cold, deficiency and excess with those hollowness of those meridian points. That can help you to come to a more in-depth interpretations of the body. Yeah, but also on top of that, you will remember the most common points for diagnosis of phlegm are stomach 14, REM 17, for the damp, the spleen 9, or for the blood stasis, spleen 10 and bladder 17. So they could all contribute to a more in-depth diagnosis of your body, of the condition and constitution. Okay. Therefore, when we get all this exterior, interior, and secondary pathology differentiation all completed, you actually come out of the end of the process of a principle differentiation. So therefore, just give you a summary how we do this all together. Usually the patient comes to you presenting a condition of a group of symptoms, usually with a leading one, focal. So therefore, you focus on the main symptom that patient has or present with you. So then investigate the diagnosis by starting a principal questions. So first the question will be, is it exterior? So definitely you need to look into the symptoms that related to the exterior symptoms. Then for that, then you need to identify the cold and heat deviation. So then if you find this is the cold symptoms, you go down to the 6 channels or 6 stage. And if you find this is the wind heat oriented, then you go down to the 4 stages or 4 levels, whatever. Or 3 burners normally related to these the dampness issues. But then if the patient doesn't really present anything with those exterior conditions, remember the exterior condition not only to do with the symptoms of the headaches and running nose and coughing and sore throat. It also includes any symptoms related to the yang meridians. Yeah, all the yang organs, all the joint pains and skin eruptions and anything like this. Then if not, there's no anything related to that, then you move on to step 2, which means the interior inquiries. The first exterior, when you believe the exterior, then you go down to the tongue reading, your pulse reading, and then you meridian palpation. Then to narrow down to the diagnosis meridian of the specific yang meridian that has the most sensitive ratings, then your conclusion on the yang exteriors is completed. Then you can just put it aside and move on to the step 2. So step 2 will be the inquiry investigations into this interior condition. when there is internal organ differentiation, then you should be able to look into those specific organs. And then for that, organs also, when you look at the organ, then you need to look into the qi, your blood, and yin and yang, these four aspects of deficiency or excess. Then when you clear it out, you should be able to come to a certain conclusion of expressive condition of the relevant organs. But mostly also important is just to follow the 3 yin channels in 6 channel differentiations. Then by how to do that is by the symptoms inquiry, and then tongue reading to allocations of those tongues of organs, and pulse reading on the middle level of the pulse, read through those different types of pulse and organs partitionings. And also then you go to the meridian palpation with all the yin meridians, and then it will gather together into a more in-depth reading about those interior conditions. When you finish the exterior and interior, then you go down to secondary pathology, which means you need to also investigate more deeper into whether there is further development of toxins accumulations. Then check for signs, symptoms of dampness, phlegm, and blood stasis, etc. And the tongue reading, normally the sublingual veins shows the dampness. The coating and spots of tongue body indicate relevantly the phlegm and blood stasis and dampness. The pulse reading, usually featuring the pulse shape, wiry, slippery, uneven pulse, they can all help you to get better readings about relevant toxins. And meridian palpation, obviously, they have specific category points, which is very much a diagnostic to help you to identify the relevant toxin. So after that, so you collect the exterior, collect the interior, the secondary pathology, you are able to conclude on the differentiation. So compare and analyze on the results from different methods and come to a final conclusion. Check the common points and deviations and analyze the possible pathology and give final answer to it. Right. Then once you got all differentiation done in your mind, you are closer to your final treatment strategies. So you know what kind of treatment points you're going to give, or what needles you need to use, what method like moxa or bloodlettings and others, gua sha and anything like this. Or you can work out your formula and as a herbalist. So this is how we can do throughout the whole process of a principle. Right. So time flies. So I think we just about right to get all this done in a package to show you how myself developed my own integrations of 8 principles, Bagang, and 6 channels, Liu Jing, and 4 stages, Wei Qi Yin Xu, and all together, and also combine these meridian palpations, tongue readings, and pulse readings. Right. So and once we get all this together, I think you're very much closer to the true fact of those people's conditions, and you are on a higher chance to get a quicker, more precise, more efficient, more successful treatment for the patient. Right, so my lecture today is about to complete, and I'm welcoming any questions. So if anybody here, I'm happy to answer any question. So everybody, if you want to answer asking questions, please, you can leave your questions on the chat, and then I'm able to read through the questions and answer it here. Or if anybody finds its writing is difficult, you could just just click your microphone and you can speak it out to me. Anybody want to ask questions? we've got some. Yes, but we need a platform to send the PDFs. I could send it through the WhatsApp, the LACA WhatsApp chatting group with Meridian Palpations. I don't know how to. Maybe you could contact me on my number. Okay, so my number is here. Oops. So add this one, my mobile number, as your okay, so I'll just write here. So can you read? Can you see my number now? Yeah. In case of previous conditions such as IBS and abdominal pain, how can we work out if the question is not completed? So I am not. Okay, Antonaska, wait, I'll answer your questions later because it's a bit complicated. I have one student, Rachel Chun, and she was asking, you mentioned special category points like Feng Long. Does it matter left or right side? So as I mentioned also, left and right, they have differential significance. So left side normally means this is the cold phlegm, and right side, it means the phlegm heat. So therefore, you need to look into which one feels more stronger, then you are able to really to diagnose properly. In terms of acupuncture treatment, it doesn't really make a huge difference just because you can treat the one needle can treat either the cold or heat. However, with the herbal treatment, left and right had a much more stronger meanings. So if it is more stronger on the left, then means you need to use the warming herbs to help with dissolve the phlegms. But if it's to do with the right side, and it will be more cooling herbs, so to dissolve the phlegms. Okay, so I still could not get questions. So the new symptoms are not affected by COVID. In case of previous conditions such as IBS and abdominal pain, how can you work it out? So basically, as I said, the young meridians or yin meridian problems, they can go on for many years. It's not always the new things. So for example, people could have those, lately we have troubles, people who have, I'm seeing one gentleman who's had an old long-going conditions, like he, the characteristic symptom is he cannot stand any air conditioning in the summertime, even though it's very hot. He go to Hainan, which is really normally is closer to like a tropical weather, and in the hotel room, in an extremely hot weather, he cannot stand air conditioning. And while we're treating him, we not particularly treat that symptom. We're treating for other conditions. We started to work on the bladder meridian. And just within 2 or 3 weeks' time, he started noticed his symptoms disappeared with those. That was in Shanghai. He lives in Shanghai. He goes to holiday in Hainan, but he cannot stand any room air conditioning. But then Shanghai, the weather, summertime weather start to get very hot now, 30 degrees. And he found out, well, he's fine. He's fine with the room air conditioning. So which to his surprise, this is that's never really has happened in his many years. He's already 50 in his 50s. So it's at least like 20, 30 years. He never managed to stay in the room. So you can see these symptoms, although they might be going for many years, but you're not aware of. This is actually a sign of yang meridian suffering, and it can be going on for many years. So the same thing, because I mentioned earlier on, the yang meridian troubles or yang meridian system illnesses not only just includes the meridian channel symptoms, they can include skin and muscular tendinous sections, but also it can include the channel and organ interiors, also the lower connecting and joints. So there could be many things, but all of them still should be called the yang, or should be called the exterior conditions. So for you, IBS, if it's happened, is affecting your large intestine, as long as they have other symptoms related to large intestine meridians, either on the skin cutaneous levels, muscular tendinous levels, or lower connecting levels, they're all still called the yang issues and the exterior issues. Obviously, IBS is not only the large intestine. There can be many others like liver, the spleen, which is more interior, and that would be other issues. So when you say about whether it's affected by COVID or not, it doesn't matter. As long as if you have large intestine meridian sufferings, it could be triggered by the COVID. It might not be. Again, we don't know exactly what happened in your IBS. So I presume this is to do with large intestine. Then if it's to do with large intestine, you need to work on large intestine, accordingly. Meridians on that. Right, okay, Basilicos, you said, if I'm not mistaken, according to Masiosia, the right body side is yin. Am I mistaken? Sorry, I got a bit confused. Right, not only you are confused, many people are confused. So just because you understand, in yin-yang concept is conditional. So when you say one side yin, one side yang, is on a certain circumstance. It's not pure. So everything has yin and yang. So even on the right side of body, we are talking about the body substance, the actual materials in your body. So on this circumstance, on this condition, right side contains the yang and qi, the heat, that type of materials. These of yang. But when we talk about the function and direction of qi movement, right side is declining, left side is inclining. So on the movement functions part of that, left side is of a yang side, right side of yin side. That's more talking about the qi's movement, the functional part of that. But to talk about material part of that, right side is more of yang, and left side is more of yin. I hope I get it clear to here. Okay, so any more questions?
Hello, Professor Liuzhong.
Hi, Mark. Hi.
Hi, how are you?
Not bad, thank you.
So very, thank you for the excellent presentation. I just want to ask regarding the learning. So we also learned regarding the patented herbs and formulas. Is that right?
Yes. Yeah. So this is the kind of the pre-sessions of the lectures. Yes.
Okay.
Yeah. But it has to be.
And then we can use this for our patients as.
Yeah. Obviously, before we go into the details of those patent herbs, you need to get your differentiation right. So that's why we started to do this one, the first lectures. Yeah. Then from the next lecture on, there will be about the formulas related to these the exterior conditions, and the formula related to the interior conditions, and the formula related to the secondary pathology.
Okay. Thank you, Professor.
Yeah. Okay, thank you. Yeah.
Thank you.
Okay, so if there is no more questions, we should call it a day. And then I hope I should see you soon for next week. And then you're welcome to join me. And then, if you are interested in joining this this course, please go to LACA's website, or contact us for for more details. Right. Thank you very much.
Thank you.
Thank you. Bye.